Hey everyone, this is Jay Ferg, and in this video I'm going to talk about one of the most important ethical and legal requirements in modern medical care: informed consent. In my last video, I shared the story of Martin Salgo and the first time the term informed consent was used publicly, but now I'm going to get into the details of informed consent itself. In general, informed consent is when a patient voluntarily agrees to a proposed medical intervention or treatment after being reasonably informed about said intervention or treatment. Valid informed consent has three requirements. First, it must be voluntary. Second, it must be informed. And third, the individual must be capable of giving their consent. I'm going to start with the easiest one first. A patient's consent must be voluntary. It cannot be forced, it cannot be coerced, and it cannot be manipulated. Consent must be given freely. Second, consent must be informed. A patient must have enough information to make a good decision. This part gets a little bit tricky. There isn't an algorithm to determine what is considered enough information. As one would expect, every patient has a different level of knowledge coming into an appointment, and many treatments or interventions have different factors that ought to be stated or emphasized. In each individual case, more or less information may be required, and different details may need to be pointed out. While there isn't an explicit method, it is typically understood that a healthcare professional has adequately informed a patient if the patient has been given as much information as a reasonable person would need to make the decision under similar circumstances. Using that standard in the broadest sense, it's safe to assume a patient needs more information than just being told that the treatment is good, but likely doesn't require so much information that the entire appointment is spent reading 20 years of research papers. A helpful introductory guide of information that a reasonable person would need consists of the nature of the treatment or intervention, the expected benefits, the risks and side effects, the likely consequences of not having the treatment or intervention, and any alternative courses of action. So if someone goes to see their doctor about a flu vaccine, the patient needs to know it's an injection, that it will help prevent the flu, that the common risks are some aches and pains as well as some soreness around the site of the injection, and a rare risk of Guillain-Barré syndrome. They need to know that if they don't get the flu vaccine, they will be more likely to get the flu, and there might be alternative options to the injection, like a nasal spray. From there, unique attributes of the case ought to be addressed. Perhaps the treatment is very new, and the risks and side effects are poorly understood. Perhaps the intervention is not covered by insurance, but a less effective option is. Details such as these, as well as answering any questions the patient may have, need to be brought up because they are important for the patient to make their decision. Finally, a patient must be capable of giving consent. This means the patient must understand the information they have been given. Informed consent is not valid if the patient has been told all of the relevant information but didn't understand a word they were told. The patient must also be able to appreciate the reasonable foreseeable consequences of their decision or lack of decision. They need to be able to use the information they were given to balance the risks and benefits of their choice. There are different ways of assessing and addressing capacity depending on where you are, but I'm going to get into that in my next video. So those are the three requirements for obtaining informed consent. It must be voluntary, it must be informed, and the patient must be capable of giving their consent. In addition to the aforementioned 3 points, it is important to recognize that obtaining consent is an active process. It requires careful consideration and judgment throughout the course of treatment. Since informed consent is voluntary, a patient can change their mind at any time. Since informed consent relies on a patient being informed, they need to be kept up to date with changes or new information that's relevant to their treatment. And since they need to be capable of giving their consent, any changes in capacity need to be taken into consideration as well. To learn more about a patient's capacity to give informed consent, please stay tuned for my next video. Thank you very much for watching, and if you like this video, please subscribe to the channel to learn more about what the hell is bioethics.